Well, let's stay on that for a second because that's intriguing, the fact that Mass Health has cut it. And you know why they've cut it. They've cut it, obviously, for the budgetary reasons.
Correct.
Is there something, being in the finance end, that we can learn about how care is administered through your program that would help us maybe across the state or across the country in terms of trying to keep our healthcare costs low? Is there a lesson here, or is this not applicable?
Well, there is, just to some extent, and obviously research is being done all the time on just to see how the care model works. But Senior Whole Health is one of 4 companies in Massachusetts that offers a very similar program. But it's a care management model, and what we do with the care management model is that each of our members, and right now we have 7,106 of them, and what we do with that is each one of those members is assigned a nurse, and that nurse visits that member, and that nurse decides, along with the primary care doctor, do we need more home services to keep this woman safe? Do we need to get this in here to keep this? Does she need Meals on Wheels? Does she need, interventions in any other way? And because of all that intervention that we do on our end with the primary care physicians, and then along with Elder Services of Merrimack Valley, for instance, up here, that it makes it clinically a safer place for the member to be. So it helps with
It helps the
everything.
member, but it also appears to me that you're able to expand your benefit portfolio in a more cost-effective way.
Correct. It's keeping people out of the hospital. It's keeping elders from slipping and falling. So with all those reductions in those extra type of healthcare needs, it's a cost-effective way to do business.
Well, when we come back on the other side of this break, I am a big demon on cost controls and healthcare costs, so maybe we'll talk a little bit more about that, and then more about the program and how interested seniors can get a hold of you. And so we will come back and talk about all of that in just a minute, so stay tuned for myself and Lisa Tkachuk. We'll be right back.
Hands can do incredible things. Now they can even help save a life with hands-only CPR. If you see an adult suddenly collapse, just call 911, then push hard and fast in the center of the chest until help arrives. Learn more at handsonlycpr.org.
Take my hand and start a brand new day. And together as one we'll start to see some change.
Underneath everything we are, underneath everything we do, we are all people, connected, interdependent, united. And when we reach out a hand to one, we can influence the condition of all. That's what it means to live united.
Welcome back to the Mayor's Corner with our guest Lisa Tkachuk from Senior Whole Health. Lisa, we're talking about healthcare and delivery, and I know it doesn't have anything to do specifically with Senior Whole Health, but I'm still intrigued by this model of care that's delivered and how your company is compensated for it. There's been some talk at the state level, a big study delivered to the legislative branch, talking about changing the fee structure overall and giving, I guess, what would you call it, a universal payment?
Yeah,
per
it's a capitated amount per patient.
Yeah, and I know that there's a lot of resistance and a lot of controversy about it in the healthcare field. It seems to me that, unless you tell me differently, that's what your model
It's
is.
very similar,
very
yes.
similar to that.
Very similar.
So what do you think? Does the model work? I know that you would probably say it does for your company, but it appears to me that there's a big way to save money there.
There is, and capitated payments are definitely, I would say, the way that insurance companies are going to pay going in the future. A long time ago, when I worked in an OB office for many years, one of the companies, we were on capitated payments with one of our companies, and I remember the physician saying, well, I can't manage this patient on this amount of money per month.
Yep.
But you have to remember, if you have patients that you don't need to manage or that don't require that kind of care, it either A, washes out, or B, you make a profit.
Right.
And that's what people don't understand about capitated rates. And it's the same. It's very similar to what we do, because what we get paid for our nursing home members, what I pay out every month for nursing home members way exceeds what we're getting paid for them. But the people that are 65, 66, they're still at home, they're driving cars, they go into bingo, they don't require as much care. We're making, our revenue will be higher for those patients than the nursing home patients, and it either washes out or you end up with extra.
A small little extra. Yeah,
Right.
and that's an intriguing thing. I mean, as a layman, I understand that some patients you're going to lose money on under
Right.
that system, but other patients, obviously, you hopefully would make it up plus.
Correct.
So you think that potentially that has a future in terms of healthcare payments?
I would bet the way they're talking, yes, because it would make it easier. It would make payments easier. It would make getting funding out easier, and just it would. I would bet eventually you'll see more of that.
Let me ask you, and I want to get back to your company, but one quick further question on that. In your case, if you have the need for something extraordinary, for example, if one of your patients needs an MRI, is that still part of the overall universal payment, or can you bill extra for that?
No, it's all part of the universal payment. We get one amount per patient per month.
So your goal as a for-profit is to deliver the best care, obviously, but you want to do it in a cost-effective way, or else you're out of business.
Correct. Right, and that's where the management model comes in, and that's why the nurses are involved. That's why we have, the contracts with like Elder Services of Merrimack Valley, and their GSSCs, their workers, their social workers are out there involved as well.
Yep.
So that you're kind of monitoring what's going on before it gets to be too late. Because it's when it gets to be too late is when you start to have a lot of problems.
Yeah.
And that's when the cost of care is a lot more.
The future of healthcare payments, I think, is going to change here in the state. And I think Massachusetts is a little bit ahead of the curve as opposed to some of the other states where we seem to be on the cusp. All right, let's go back to Senior Whole Health. Let's talk about it since it is Senior Whole Health. What is the policy, or what is the program with prescription drugs?
We cover all prescription drugs. Any prescription medication that is prescribed by a writing physician is covered under the program. So we actually become their Part D carrier. So in this day and age when people are looking now for a Part D carrier, it's open enrollment, we are their Part D carrier. So if they're paying for a Part D carrier, they don't have to pay for that Part D carrier anymore because we'll cover all their prescriptions. If they're on a particular medication that is considered a brand name medication, when they come onto the program, they will stay on that medication until we get authorization from the physician as to why they're on that medication. And then 9 times out of 10, they stay on that medication anyway. We don't want to change. We don't make the changes when they come onto the program. That's not what we're here to do.
Yeah. And so I heard you say open enrollment. What brings me to my next question. How do you enroll with Senior Whole Health?
It is open enrollment in the Medicare world right now. It ends this end of December. But for Senior Whole Health, we enroll all year long. The way our contracts are written, we do this all year long. So we don't have open enrollment periods. So if someone wanted to, or is interested in the program, had a loved one that was, that may benefit from something like this, all they need to do is call in to the office, and we can set up appointments in respect with language, a language if a particular person speaks Spanish or anything like that, with the appropriate representative to go out and see them. They can either call the number here.
What is that
I don't know the number.
What
is that awful?
Number?
The office number is 888-566-3526. That connects directly to the outreach department, which is my department, where the phones are answered till like 8 o'clock at night anyway by somebody. Other than that, they can call me directly. My cell phone number is 617-910-7720, and I can go forward and make appointments for people as well for different things or answer questions.